and welcome back to Health Watch. We've been talking to Dr. Tony Tomtot, and when we left, we talked about a little bit about the actual insertion techniques, and we're going to show some of your needles. But just give me a sense of your patients when they're they're having a pain. You say you usually leave them there for about 15 minutes with the needles in. It's more than one needle, I assume.
Yeah.
Depending on what you're treating.
Exactly. It depends on the condition. Sometimes we put the needle in the area where the patient have pain, and sometimes I put the needle in the other part, like the opposite side or down to the hand or the feet. And sometimes when I do the needle, and it's, for example, if I put the needle on the left side of the neck, and occasionally patients said, I feel some pain down into my right foot. So they're telling you that everything connected with the meridian.
Yeah, that's interesting. And would you expect a response right away? I mean, if I'm having, my pain is X, and if I do this, do you get a response right away, or do you have to really have?
It's a good question. Sometimes it's hard to give you a good response because it varies from patient to patient with different condition. If they have the condition we call acutely, that means it's less than 6 weeks, and usually the patient responds really well after the first or second treatment. If they have a chronic condition, usually we'll recommend for the third and the fourth treatment. Usually for the treatment plan, I recommend once a week for 4 weeks. After the third or the 4 weeks, the patient will tell me, number one, there's a pain level drop. Does the patient take less pain medication? Improvement on functional activity. Can they walk? Can they sit? Can they stand with less discomfort? If there is improvement, that means working will continue from there. But after the third and the fourth treatment, if they don't see any relief, that means acupuncture is not working.
It's not working
we'll
for
stop
that
right
particular
there.
condition.
Yes.
Well, let's talk about some of the conditions that you end up seeing. We'd be remiss if we didn't talk about cephalgia or migraine headaches in general, chronic headaches.
Recently we see a lot of patients come in with migraine headache. Neck pain, migraine, and they already saw so many neurologists, and they've been taking a lot of narcotic, different migraine medication. The intensity, the frequency of the migraine is still up there. So they're looking for the alternative treatment, and they found us in Lancaster Neuroscience, and I did a couple treatment with the medical acupuncture, and then a lot of patients get good relief. I can say that up into 60 to 70% patient with migraine has some good relief after the third and the fourth treatment.
Now, where would a meridian be for that? I mean, where you?
I can show to you if the patient have migraine headache, if they have neck pain come along with that. Usually, on that model here, you can see a lot of different points in the neck and behind the scalp here. I can put the needle along the sides where the patient have pain here, and some point up into the scalp and along the sides of the earlobe. And I hook up with the electrical stimulation, and I put the special infrared heat there, and let the patient lay down for 15-20 minutes. That's for treatment.
Really?
And after the third and the fourth treatment, I see a lot of patients come back happily. They take less pain medication, their intensity and frequency of migraine significantly drop.
Really? Is it different for like tension cephalgia? Not everybody has migraines, and
yeah,
a lot of people have chronic tension cephalgia. Is that
and
the same type of basic treatment, same zones?
It's almost the same zone area, and it varies a little bit from patient to patient. It depends on the tender point that I can know. If I can examine and evaluate some tender point, I can focus more along with the migraine point.
Right. So much of our society, since we have our patient here turned to the back, is back pain. People are, it's a chronic condition in this country that's really rampant, and it's probably the most common reason people are out of work.
Exactly, and you see that low back pain is the most common. They give a disability to the patient. They can't function, they can't do things, and they take a lot of medication. They went through all different procedure, surgery, and invasive procedure. It's not giving a good relief or short term, and they come to see us. Usually we prefer them to be seen earlier than that. So we try to treat them in early stage rather than advanced stage like that. We'll get some better relief. But even though after the condition, after they have back surgery, multiple procedures, we can still treat them well. And then hopefully we can cut down the level of the pain. Instead of 10 out of 10, we cut down to like 5, 4 out of 10. That's controllable. Or they take less pain medication, less side effect. And for back pain, we usually focus in the back along the acupuncture point in the spine. And then sometimes we can go down to the leg. It depends if the patient have muscle, disc problem, or nerve problem, and we can treat differently.
Okay, good. I want to make sure we cover it before they go. We've talked a lot about needles. and I want to make sure we've done this before on a previous show. But let's just we'll get some close-ups of the needles so we can kind of show it. But talk to me about the needles themselves. They're really quite
the needle himself. We can show to you in detail, but it's very tiny, very thin, and it has a different class, a different size of the needle. It depends on different body part, but basically it's very thin. Needle is not the same needle you use to draw blood, so it's not coming. The blood will not coming out anything, and it's sterile, disposable. A lot of patients ask, "Can you reuse the needle?" I said, "No, it's just disposable." So after every single patient, you throw away, and the only needle you reuse is you sterilize it. It's a gold needle, but I don't use it. Some patients use that. Yeah.
Yeah, I guess the concern would be the transmission of infectious
disease.
agents
Exactly.
And all like that,
yes.
and you're certainly not having that issue.
Correct.
Yeah, we've talked about this before. Show me a little bit if you can show the needle and how you
and you can see
this
is the needle here. I can just open the envelope here, and you can see that the needle is very thin, and you can not really see it. It's very thin, and this is the length of the needle. Sometimes we go through halfway or just all the way. It depends on the body part. It depends on the acupuncture point.
So you might inject the whole needle into the area, depending on where you are. Because these meridians are they surface or are they?
It depends. You can see it here, but then when you go to dissect the anatomy, and you can see that sometimes it's underneath, very thin. Very superficial. Sometimes it's deep too. It depends. And then based on the experience, we'll go through by manipulate and palpate the energy, the acupuncture point, and we can insert the needle.
Really? It's fascinating. I think that's one where in this society it's been sort of pressed to bring into our common diagnostic and therapeutic regime.
And if you want, I have needle here. I can try on you.
I'm more than willing. We did this once before. I'll just attest to the fact that there's not much pain. So we can do it. Where would you want to do?
Around your hands. That's usually we can do that. So usually this is the energy point to give you a lot of good energy. Maybe after the treatment here. Usually I palpate. We got a minute, so you got. So I go directly here, and then here we go, and then that's what we do. That's usually.
I absolutely didn't feel that.
That's a lot of patients don't feel much at all.
Really, but I feel like running a marathon now, so that's a good.
That's good. You can have energy to run a marathon now.
Okay, well, I'll attest to that. Tony, it's always a pleasure to have you. We're going to have your certainly your contact point on the screen here now, so people can contact you for this. But they would what would they do? Just bring ask for an appointment with you in your office.
Exactly.
If you're interested in acupuncture and that.
And we can evaluate and see what is appropriate for them, and then we'll make some good treatment, a really good recommendation.
Yeah, most of the time they will have like I say, in this modern age, you have access to their CAT scan or their MRI.
We can have access to MRI if we need further investigation. We can do that. We can recommend all that.
Great. Always a pleasure talking to you, Tony.
Thanks for having me.
And we'll thank you for watching Health Watch.